West. Hello everyone, welcome. I'm here to discuss COVID-19 vaccinations as of January 7th, 2021. We are in the midst of a rollout of the initial COVID vaccines, and I'd love to give everybody a little bit of an update. First, I thought I might go ahead and give some information about the COVID pandemic. As we're all aware, the numbers continue to rise across the globe in many different areas. There have been 87 million plus cases diagnosed so far across the globe in the last year. We had on averaging about 800,000 new cases per day, and there have been 1.8 million deaths since the start of the pandemic globally. Unfortunately, the United States is leading the charge with 21 million plus cases, and the next country down has about 10 million cases, and that's India. So we are well ahead of the rest of the countries globally as far as the number of cases that we are experiencing. As you know, we have hotspots in a lot of different areas across the country. California has seen the greatest number of cases with 2.5 million total cases, and in our area, Virginia is down to about the 20th state now as far as the number of total cases that have been experienced in the area. We are seeing about 250,000 new cases nationally, about 5,000 new cases per day in the state of Virginia, and a little over 300 new cases daily in Fairfax County at this time. Fortunately, while the number of positive tests is rising in for the whole state of Virginia, it's at 15.9% today, but luckily we still are only at 72% capacity with our ICU beds. So we still just for reference, 90% is considered a severely strained system. So we are not yet at that point, which is reassuring. Inova currently has 276 hospitalized patients who are being treated or who have been diagnosed with COVID-19. The good news is that a vaccine has been created. In fact, three have been approved so far, with several others coming down the pipeline. And the first COVID vaccines were given in Virginia beginning in the middle of December. And to date, there have been about 136,000 Virginians who have been vaccinated with at least the first of the series. We have about 5,000 or 6,000 who have received both at this time, and more are getting them on a regular daily basis. In our Fairfax County area, Inova is one of the major distributors of the vaccine, and currently they have been focusing on the highest tier of people who are highest risk tier, and those are the frontline healthcare workers. To date, over 17,000 vaccinations have been distributed by Inova Fairfax Hospital. The other group that has been doing very well, the Virginia Department of Health, is distributing them in many places, and several large pharmacy chains have been involved in distributing to skilled nursing centers, and that vaccination process is continuing daily. I thought we might talk a little bit about some of the benefits of the vaccine, but also just a little bit more answering some general questions that I've received over the last few weeks, because I really do think that knowledge is power, and the more we understand about these, then the more we can be proactive about taking good care of ourselves. So the vaccines that are available against the coronavirus, COVID-19, are mRNA vaccines, and the short summation of what an mRNA vaccine does is it causes our cells to produce a protein that's unique to COVID-19. Our immune systems respond to these proteins by removing them, and then they create a memory in the body of how to recognize and remove these types of proteins if they are ever introduced again in the future. There are no actual virus particles in the vaccine. That's very important. No one will ever get COVID-19 by taking this vaccine. The real question, now to date in the state of Virginia, about 481,000 doses have been distributed to places to be administered. So we're in the process now of getting those vaccines into the arms of the people who need them. The distribution of the vaccine is pretty complicated. It is driven primarily by the state Department of Health and the county's Departments of Health, and the major hospital systems are working in conjunction with the Department of Health to receive them. As far as who's going to get the vaccine, as many of you probably have heard by now, there are different phases for administration. And the first phase, which is phase 1A in the state of Virginia, and each state labels them slightly differently, is the group that I mentioned, those frontline healthcare personnel plus long-term care facility residents and staff. We are in phase 1 now, and we're actively trying to administer vaccines to the people who want them in that group of individuals. Sometime fairly soon, we're waiting to hear when, we will move into phase 2, or I'm sorry, into phase 1B, which is encompasses a larger group of people. Phase 1B includes frontline essential workers and people over the age of 75, as well as people who live in homeless shelters, migrant labor camps, and correctional facilities. So the good news for 1B is that that also includes pre-K through 12 teachers and staff of school systems. It does not yet include university staff or teachers. The 1B phase also includes police, firemen, people working in manufacturing, grocery store workers, people in the food and agriculture industries, public transit workers, and mail carriers. So those will come in the next group. That will be a significant sized group, and it will take some time to get those people vaccinated. Then phase 1C is the next group that we will see, and there is no timeline yet that has been determined by the state of Virginia for when these will roll out. But phase 1C includes other essential workers, and then people who are age 65 to 74, and then also people age 16 to 64 with high-risk medical conditions. So I thought you might enjoy talking about that a little bit. I'm happy to elaborate further. Phase 1C essential workers include people who work in the energy industry, water and wastewater industries, housing and construction, food service, transportation, institutions of higher education, the finance industry, information technology and communication, the media, legal services, public safety, and other public health workers. The group of individuals 16 to 64 who would qualify for high-risk medical conditions would include a list of people who are at greatest risk for severe illness from the virus. And by severe illness, they mean hospital admission, ICU admission, the requirement of a ventilator, and significant increased risk of death. And that list is a fairly extensive list, and then there's another list which has not been entirely determined yet. But those who are considered to be at increased risk of severe illness, and this would be phase 1C, people between the ages of 16 and 64, would include cancer patients, those with chronic kidney disease, those with COPD, Down syndrome patients, people with heart conditions like heart failure, coronary artery disease, or cardiomyopathy, people who are in an immunocompromised state from solid organ transplant, and people who are obese, meaning a body mass index of 30 or greater. So obese and severely obese or morbidly obese individuals would count into that at-risk medical group for phase 1C. Also, anybody with sickle cell disease, type 2 diabetes, and all smokers would qualify in that group. There's another group that is felt they might be at increased risk. We have limited data right now on how COVID-19 infections might impact these people, but they could potentially qualify for an earlier vaccine. And that includes anybody with a body weight over 25, a body mass index over 25, people with moderate to severe asthma, people with cerebrovascular disease affecting the blood supply to the brain, people with cystic fibrosis, people with hypertension, anybody with a weakened immune system due to bone marrow transplant, immunodeficiency, HIV, or the use of corticosteroids, those with dementia, and those with liver disease. So it's a long list of people, as you can see. And then once you've worked our way through all of those people with phases 1A, 1B, and 1C, we reach phase 2, which is basically everybody else. I know Dr. Fauci had spoken very hopefully that we would be able to have everybody in this country who wants to be vaccinated by early summer. And we are still hopeful about that. Unfortunately, some of the rollout and distribution and vaccination process has been a little bit slower than one might expect or one might hope, and I'm sure that those processes are being looked at closely to try to expedite getting as many people vaccinated as possible. There was a survey in the Annals of Internal Medicine which looked at, or an article which studied or described a study looking at people's willingness to be vaccinated and how to best optimize our chances for getting the whole country vaccinated. And it was very interesting to see that about 60% of people are willing and eager to get the vaccine. About 30% of people aren't sure, and about 10% are adamantly opposed to receiving this vaccine. And another interesting thing that the study showed was that our best chances for getting as much of the country vaccinated as possible would be to focus our attention on the 60% who truly want to be vaccinated, to make certain that there are as few barriers as possible to receiving the vaccine. Those who are in the not sure category, some time and effort and education may be of help. Those who are adamantly opposed are most likely not going to change their minds. So I think that this is all really interesting information, and the combination of adequate testing and adequate vaccination and then continuing to follow social distancing guidelines until the number of cases has really dropped much lower than it is now are going to be our best bets for ending this pandemic as effectively as possible. So those are my insights about COVID vaccines in Northern Virginia as of the early January. If anyone has questions, please let me know. I would be most happy to answer them. Let me see, there might be a couple of comments here. What are the side effects of the vaccine you've heard of so far? In the studies that they've looked at, approximately 20% of patients receiving the placebo vaccine have experienced mild to moderate complications. about a slightly higher percentage of people, meaning that the difference could in fact be due to the vaccine, has been seen in the group that has actually received the vaccine. What we're hearing about so far are primarily very mild symptoms. Some people are experiencing nothing. Other people might have a sore arm for a day or two, which was the case for me when I had my first vaccine 3 weeks ago, and again yesterday I received the second vaccine. Just a little bit of arm soreness. So far, nothing else. Other people are noting that they are experiencing a fever for a few hours, up to a day. Other people are experiencing fatigue or nausea. Sometimes a few people have documented that they've been experiencing some lymph node activity, increased lymph nodes, for a week after the vaccine. The most significant complications, there's a slightly higher chance, they believe, with this vaccine than with the flu vaccine, of having an anaphylactic reaction, which is, a significant allergic reaction, or serious allergic reaction. But the good news is that with monitoring after administering the vaccine, and also having things like EpiPens available, those serious complications have not resulted in deaths at this time. They've been reversible pretty quickly. So right now the only contraindication to receiving this vaccine is if you have previously had an anaphylactic reaction to this vaccine. So obviously there aren't tons and tons of people out there who have had this vaccine. We have all of those who participated in the study trials over the last 5 or 6 months, plus the last 3 weeks of recipients. The number of serious adverse reactions has been very, very low. And every major medical organization has approved and sanctioned the use of and recommended the use of this vaccine. When I looked at the number of people, the committee, the FDA committee that was approving or declining the new vaccines as they rolled out, it was very interesting to note that among the dissenters, the people who didn't think that the vaccine should be released to the public, one of them was a pediatrician who felt strongly that the data for 16 and 17-year-olds wasn't yet robust enough to administer it to that group. However, she felt wholeheartedly that 18 and above, the vaccine was safe and should be approved. So, how many doses will be needed? It depends on which vaccine you're receiving. Right now, the vaccine options that we have available to us require 2 doses. The Pfizer vaccine requires that the doses be between 21 and 24 days apart, and the Moderna vaccine recommends that second dose at the 28-day mark. So, but once you've had the second dose, about 10 days following the second dose, you are considered to have mounted a significant immune response against COVID-19. Even after the first, there is some immunity, but it won't last. You really need that second dose, the booster dose, to complete the task. So, are there any other vaccines that will help prevent me from getting COVID? That's a really interesting question, and there has been some discussion about potentially other vaccines causing some protection. I don't think that anybody is ready to put it in writing as definitive yet, but they're looking at people who have received the BCG vaccine against tuberculosis, which has been commonly given in a number of countries outside the U.S. It has not been administered in the U.S. for a long time, so it's unlikely that any of the people, certainly under the middle age, would have received a BCG vaccine. But there's also some question about whether the MMR vaccine may offer a little bit of attenuation of a COVID infection, meaning that it could lead to milder symptoms. So these are as yet unwritten answers, and lots of people are looking at it. So, all right. If there are no other questions, I will go ahead and wrap up for now. Thank you for tuning in. I hope that you found it informative. Happy New Year to all of you. And keep those questions coming. Let us know what else we can do to help. Thank you. Bye now.